Hi, I'm Dr. Austin Hayes. I'm a board certified plastic surgeon at Portland Plastic Surgery Group in Portland, Oregon. There's three components of a beautifully shaped breast, and they require a very strong fold with the breast being filled, and ideally it's filled from top to bottom, and then a very tight skin envelope. And I think there's a couple of factors. So if you're looking at a breast lift that I performed and you're looking at a traditional breast lift, many times you'll see that the cleavage is more full and that the top is more full. And the reason for that is that kind of every layer of the three layers that we've created has pushed the breast tissue up and kind of locked it in place. And it doesn't take very much volume, or as in the converse, it doesn't take very much loss of volume. So after you do a lift and the breast tissue, you do a traditional lift and the breast tissue falls, you lose cleavage and you lose upper fullness. And all of a sudden, you're not wondering if that person had an implant because you know they didn't, because they've simply lost too much volume out of their breast. The other thing, and this was not really planned, but layer number 2 secures the skin very tightly. And what we were finding is as we were able to keep the skin of the breast locked in and tight, it created a rounder look for the breast itself. So the breast was taking on a rounder, less boxy look. It's creating a roundness that replicated, or what made your mind think was coming from an implant. And in fact, it wasn't. It was just coming from, again, being able to make the skin of the breast very taut. The layers also, kind of in keeping the skin tight, really shape the lateral breast. So the lateral breast has a kind of a beautiful side boob, I guess would be the description. So the side boob line is so well defined by the triple bra that it makes you think that an implant is what's creating that, especially when you compare it to a traditional breast lift. The one thing I would say about that is that that's an early result. So that's a 1 week result. And being able to accomplish that at 1 week is, even a traditional breast lift might look like this at 1 week. The thing is that over time, the anchor point at the bottom, because it has no support, is going to give and the breast tissue is going to fall. So that's not what that person will continue to look like. Now here, this is the same individual. Here she is at 2 months. And so now there's been plenty of time for the weight of the breast tissue to sit on the fold. A traditional breast lift, in my opinion, will already start falling at this point. You'll see the scar up on the breast. You'll see that the breast has slid down the torso. But here, she actually doesn't have that. If you go to the close-up side, like the side view, if we look closely at this photo, we can see that her scar is perfectly tucked in her fold. And that's what that is it's showing that the breast has stayed perfectly in position. It has not settled. It has not slid down her torso. Every cc of volume that we put into her breast has stayed. And again, that's all from the natural internal support that we're creating. And so, it's after a month is where the difference between traditional and triple bra, or breasts that are supported and breasts that are not, really start to show up. Because posting an early result of a breast lift is not always how they're going to look unless they have some type of support. And again, we do that with all natural tissue. If we're going to embark on a possible 2-stage journey, we want to make sure that we don't even really start the journey unless we have a place where they can land, either after 1 or after 2, where they're really happy. So we need to really get to the bottom of, are they currently having things that bug them that are going to be solved by step 1? And so obviously step 1 is the breast lift. And when people come in, they might be focused on whether they need an implant, but if we can get to, hey, they're actually really bothered that they can't wear a dress without a bra, and that they are always wearing a bra at home and they never go braless. Basically, we realize that 95% of the time I'm bothered by the fact that my breasts sag. I'm actually not bothered that they're not big enough. Then we know automatically that step 1 they're going to be thrilled. And so then the question becomes, okay, they've had their breast lift now, they've had it for a few months. All those issues that we were talking about before are addressed. Is there anything residual? Is there a time where I don't have the volume I'm looking for? I'm wearing this outfit and I wish it was more full at the top, or simply my breast is not big enough and proportional enough to my body. Now, all of a sudden, we're thinking about adding an implant. But we've already solved for, again, this is my perspective, we've solved 90% of what's bothering them. And for many patients, we solved 100% of what's bothering them. And there's no consideration for implant. But for the people who are wondering, it gives them opportunity to really get the main stuff out of the way and see if there's really that desire for the second step implant. People will come in and it might be a breast lift consult and we get to talk. I mean, I'll examine them and clearly their breasts are very heavy. And I'll ask them the standard questions. Do you have neck pain, shoulder pain, headaches late in the day? And they're answering yes, yes, yes. And then they say, do you think that could be related to my breasts? And, it's so obvious to me because obviously this is what I do. But as humans, we are so adaptable that we adapt to something and then it becomes normal and it's just kind of put aside mentally. I have patients who travel from all over to come see me for this operation. And one of the nice things about breast lift and breast reduction is that it doesn't tend to be that painful, and we don't require that people stay in town for too long. So if people are driving to see me, they might stay just a few days. When they fly to see me, they might stay somewhere between 5 to 7 days. Obviously, there's more coordination with follow-up and that sort of thing, but they don't tend to be staying in town for 2 weeks like a tummy tuck who comes to see me. And then people are actually quite comfortable. So instead of being kind of locked in their hotel room for a week, they actually get to see a little bit of Portland and kind of be a little more active than you would typically think recovering from surgery. When it comes to the financial component of the operations that we do, my coordinator, Erica, is amazing at letting you know all of your options, working with you, and kind of helping you figure out how you navigate that part of the surgical process. We're really lucky. The Portland airport actually just went through a remodel. It's gorgeous, very pretty, easy airport to get in and out of. We're about 20 minutes from the airport. And then downtown, we have a new Ritz-Carlton, which has been here for, I think, 2 to 3 years now. Really lovely place to recover. Portland has a great food scene. There's many restaurants downtown, which are close to our office. For patients who want kind of another level of care, we've had it where we can do all post-op visits in the hotel. It may be a nurse, a PA, it may be me coming to see you. So basically, we're able to offer any level of care that someone is seeking.